Within this safety and wellness module, we will look at stress management for the paramedic. Once completed with this module, you should be able to describe the three phases of the stress response, factors that trigger stress response, and causes of stress in EMS. Describe the defense mechanisms and management techniques commonly used to deal with stress, and describe the stages of the grieving process and the unique challenges for paramedics in dealing with themselves, adults, children, and other special populations related to their understanding of death and dying. In evaluating stress within the EMS environment for EMS providers, let's begin by looking at generally defined types of stress responses by the mind and body. The first type of stress response is known as an acute stress reaction. This is similar to what is commonly known as the flight, fight, or freeze reaction. Some type of threatening, extreme, or shocking event occurs, and the body activates the sympathetic nervous system, which will be discussed in greater depth within a different module, to help the person focus and react to that threat or event. Pupils dilate, the heart rate quickens, respirations increase, and blood vessels dilate to skeletal muscle while constricting to gastrointestinal organs. While the purpose of the stress response was critical back in the day when humans were not so high on the food chain, this same response in the modern world can be detrimental, especially for an EMS provider, as fine motor control is sacrificed, making it harder for the paramedic to perform delicate and precise interventions, such as intubation or peripheral IV access, as stress and the body's sympathetic nervous system response to that stress increase. Nausea, shaking, nervousness, excitement, and other related symptoms may manifest themselves given an acute stress reaction. Some individuals under such stress find it easier to focus, while others may experience a type of paralysis where they find themselves frozen and unable to move or think. Some may also experience an overwhelming desire to flee the circumstances, which can be difficult for a professional rescuer who must proceed headlong into dangerous circumstances under which most rational people attempt to flee. With those different responses in mind, some people and EMS providers find themselves experiencing a delayed stress reaction to critical incidents. When this happens, the EMS provider is indeed able to focus and function to mitigate the critical event or incident, only to find him or herself overwhelmed sometime after the event as he or she finds time to think about the event. For some, this delayed stress reaction manifests itself in a panic attack. Others experience heightened feelings of anxiety in a period of time after the event. Post-traumatic stress is also recognized as a type of delayed stress reaction, which may also tie into the third type of stress reaction, cumulative stress reaction. Emergency workers are routinely exposed to stressful and extreme conditions, environments, and circumstances. Over a period of time, it is not unusual for emergency workers to become somewhat desensitized to these stressors on a call-by-call basis. What is happening, though, is that the EMS provider is simply building up a tolerance to the stress. The stress is not eliminated. This is somewhat similar to the alcoholic who does not appear intoxicated or impaired after considerable alcoholic consumption that would have a significant impact on someone who does not drink very often. The individual's blood alcohol concentration is still elevated, yet the person's body has adapted to those higher levels of alcohol. Many consider the stress associated with being an emergency worker to be the same thing. The stress is still there, and the body is still impacted by it, but the provider has become used to dealing with those frequent emergency circumstances. Stated another way, the provider's body is used to running on high idle. Over time, however, the cumulative nature of those psychological stressors can have a very real negative impact on the provider. As far as these stress reactions are concerned, there is routinely some type of trigger that precedes the reaction. Within the EMS environment, these can be easy to identify as EMS providers routinely must mitigate circumstances related to other people's tragedies. EMS providers may also have their own stressors outside of those experienced by providing emergency response services, and many resources recognize numerous work and life stressors that can increase anxiety and stress responses within a person. Some work stressors include job dissatisfaction, a heavy or unmanageable workload, long hours, dangerous conditions, insecurity in the position, poor management and a lack of control over one's own direction or work, harassment or discrimination, and the need to speak or give presentations in front of peers or others. Personal life stressors can include a death or chronic disease or illness within the family or intimate social circles, divorce or marriage, increasing financial burdens, moving, serving as a caregiver to elderly, disabled, or other family members, or experiencing some type of personal traumatic event, such as being the victim of a violent crime, suffering from a natural or other disaster, experiencing a legal issue, or any other number of challenges that may arise in daily life. Everyone experiences stress in their lives, and a certain amount of stress is normal and arguably healthy within the human experience. Where stress becomes a problem, however, is when it begins to take a sustained, long-term, or ongoing physical or psychological toll on the individual. As every person is different experiences and levels of stress impact different people in different ways at different times. When an individual begins experiencing significant or ongoing physical or psychological manifestations of stress, regardless of the precipitating event or events or the period of time over which they developed, immediate steps must be taken to mitigate that unhealthy stress, or things will only become worse. While the list is by no means exhaustive, the following, in no particular order, are just some of the unhealthy physical or psychological manifestations of chronic or significant stress that can take a significant toll on the health and well-being of anyone, EMS providers as well. Fatigue, low energy, tiredness, headaches, chest pain or tightness, high blood pressure, gastrointestinal issues, easily agitated, irritated, or moody, suffering from uncontrollable temper tantrums, outbursts, or fits of violence or rage, nervousness, cynical or pessimistic, anxiety, depression, feelings of low self-esteem, worthlessness, hopelessness, being overwhelmed, self-harm, suicidal ideations, loss of ability to concentrate, forgetfulness, withdrawal from others, declining interests in hobbies, decreased libido, declining health such as frequent colds or infections, eating disorders, which could include a decreased appetite, anorexia, or overeating leading to obesity, insomnia or loss of sleep that includes the need for self-medication, or experiencing multiple awakenings, where an EMS provider wakes up several times over the course of an evening thinking a call alert came in, or checking the pager to make sure a call was not missed, alcoholism, or drug or tobacco use. EMS providers, more so than any other type of emergency worker, routinely deal with death and dying. While it is a simple fact of life that everyone dies, emergency workers routinely see such death within the context of traumatic or unfortunate events that are anything but natural. People dying due to violent acts or horrific injuries can be particularly trying, and the younger a person is when he or she dies, the greater the emotional toll the death seems to take on others. Beyond managing their own feelings with regard to the death of a patient, EMS providers must often routinely deal with friends, family members, and other acquaintances of the deceased while on the scene. To assist EMS providers in coping with their own feelings about death and dying, along with the perspective and occasional need to console others on emergency scenes where someone has died, it is important to understand the recognized stages of the grieving process. The first stage of the grieving process is denial. The brain simply does not want to accept that the person is dead. This is why healthcare providers are routinely trained to be very clear when informing a person that a loved one has died. Saying things like, "the person is no longer with us," "the person has transitioned or passed on," or something similar can actually lengthen this stage of grieving. Telling someone directly that their loved one is dead may be more difficult and seems cold, but it can be important for that person to hear in absolute terms that their loved one is indeed dead. Transitionary or vague terms or language is not necessarily helpful. After the person accepts the death, the next step is typically anger. The anger could be related directly to the personal loss of the loved one. The person may feel angry that he or she did not suffer the same fate, or the individual may be angry at fate, the world, a deity, or whomever they feel is responsible for the death and subsequent loss. This can be challenging for healthcare providers, especially if that anger is directed at them. With this in mind, it is common for healthcare providers to inform the loved ones of the deceased that they did everything they could for them. It is kind of a proactive measure to help blunt those feelings of anger before they manifest. Bargaining is the next recognized step in the grieving process. Once a person can no longer deny the death and he or she realizes that being angry does not change anything or magically bring the person back from the dead, it is not uncommon for the grieving person to make a deal with himself or a deity to help cope with the loss. Once those efforts to mitigate the death fail, the fourth step of the grieving process is depression. Essentially, the person realizes that nothing further can be done, and despite his or her denial, anger, and bargaining, the death is final. The loved one is dead, and there is no coming back. For many people, this is the impetus that drowns them in greater sorrow and depression. Lastly, acceptance is the final phase of the grieving process in which healing occurs, so to speak. The death cannot be undone, but the person learns to move on despite the loss of a loved one. Because each person is unique and each circumstance surrounding a death is different, these stages can take different lengths of time to pass, and the progression need not necessarily be linear, as some people slip back and forth between the stages during their journey to acceptance. While we discuss the grieving process from the perspective of someone who survives the dying person, the same process is experienced by those who are dying or know they are going to die soon. For the terminal cancer patient, as an example, the denial occurs when the diagnosis is first delivered and the person wants a second opinion, as there must surely be an error. I cannot have cancer. Once that diagnosis is confirmed and it sinks in, however, anger typically follows. Why me? What have I done to deserve this? May be common questions asked by the patient. Often bargaining then entails a plea for recovery or to simply have more time. If I can be cured, I promise I will donate more of my time to some worthy cause. All I ask for is to be here long enough to see the birth of my grandson, and so on. Depression can be debilitating, and some may not even reach the acceptance stage before death. The topic becomes a little more challenging when the person facing pending death has diminished capacity, such as a child, someone with cognitive disabilities, or other special populations, which could include the elderly. Trying to console a dying person is hard enough without having to also address instances where the patient may not be able to understand what is happening or just how close he or she is to death's door. EMS providers must continue to be empathetic while also trying to communicate as effectively as possible at a level appropriate for the patient to alleviate the fears of a dying patient. In some cases, just being there so that the person knows he or she is not alone during those last moments can make all the difference for that patient. For the EMS provider who deals with death and dying on a regular basis, understanding the grieving process is helpful when working with patients, their friends, and family. It still does not eliminate the stress associated with these events, however, especially if the circumstances are particularly horrific, traumatic, or unfortunate. Obviously, the mind has a powerful influence on the body and our overall health and wellness. While the cumulative effects of stress on the mind and body can be significant and detrimental to an EMS provider, the good news is that there are ways to effectively manage and mitigate stress to ensure that stress does not become the impetus for poor psychological and physical health. Some of the ways to mitigate stress include changes in one's lifestyle. Exercise is recognized to have considerable benefit in mitigating stress, as is the importance of maintaining a healthy and well-rounded diet. Related to lifestyle changes is the need to also find balance in life. As much as EMS providers tend to internalize their work, it is important to recognize that work is work, and EMS providers must make time for personal pursuits outside of work. Participate in social and other activities that you enjoy away from your work environment. Give yourself time to decompress and recharge your batteries, so to speak. Along those lines, also recognize just how important it is to have family, friends, and loved ones within your life to keep you grounded and to provide support. While those within the protective services professions are often told they must be tougher than the rest, we are now also recognizing the impact of mental health on the overall health and wellness of EMS providers. While it is true that an EMS provider must often be the calm eye in the center of the storm while mitigating an emergency, once away from that environment, it is no longer necessary to maintain that facade, and it is important for EMS providers to have an outlet for their thoughts, fears, and concerns. The suck it up, keep it to yourself, rub some dirt on it mentality has failed the profession over time, and we now recognize the importance of peer support networks and employee assistance plans that include psychological support. If you are experiencing issues, say something. Approach someone you trust and share your experience and thoughts with them. Peer-to-peer support networks are very beneficial in this regard. Many emergency workers do not discuss work and the things they see with their spouses, families, or loved ones because they want to shield their loved ones from that world. There is also a fear or concern that the spouse or family member will never understand or that the provider will be judged for having the thoughts and feelings that he or she is having. Being able to share and discuss these thoughts and experiences is important to normalize them for the provider, however. Peers understand what you are going through because they experience the same things. While a spouse may not be able to relate to the job, that familiarity is not necessary for him or her to listen and support you. If all else fails, there are also professional resources available to help. Many employers provide employee assistance programs that will provide psychological support when necessary. Some hospitals and healthcare organizations provide those services. There are also nonprofit organizations that make it their mission to help others in psychological crisis. The short story is that you are not alone and do not have to struggle through without assistance. While many EMS providers probably consider themselves to be an island unto themselves, that mentality and belief is flawed when the provider is suffering psychologically. If you need it, there is nothing wrong or dishonorable about seeking help. Actually, quite the contrary is true. You are not weak, as it takes a very strong person to admit when he or she is beyond their own internal capacity to cope with the traumas and tragedies to which he or she is routinely exposed as an emergency care worker. There is no shame in seeking help when you need it. Remember that you are supported, others have the same struggles, and no person is an island. Everyone needs help every now and again. Even the rescuers occasionally need assistance themselves. That is more than okay. It is both necessary and accepted. Lastly, if all else fails and the job continues to take a psychological toll on the provider, it may be time for a change in work environment or profession. Find another job that you enjoy with less stress. While EMS can be a calling for many, at the end of the day, it is still just a job, and if your job is eating you alive, it is probably better to cut ties and move on than it is to continue following the path toward destruction. Besides, if that is happening to you, it is likely that your despair is also impacting your job performance and the level of service provided to your patients. For the benefit of both yourself and your patients, sometimes there is a point at which it is best to hang up the stethoscope and move on. If you remember in an earlier module, we talked about the toll the job of an EMS professional can take on people. Numerous reports and studies have shown time and again that emergency workers, including EMS providers, suffer from higher rates of divorce, depression, post-traumatic stress, alcoholism, and suicide. This is a trend that needs to stop, and it does so with you. Your health, both physical and psychological, is important. Remember, dead heroes cannot save others. The goal for any EMS provider should be to have a long and fulfilling career that allows you to one day retire and reflect back on all those random strangers you were able to help in their time of need. By remembering and applying some of the principles we discussed here and in other modules, the hope is that we can reverse the trends in EMS and see more of our providers maintaining both their physical and psychological health and well-being. Given your completion of this module, you should now have a better understanding of stress management for paramedics and be able to describe the 3 phases of the stress response, factors that trigger the stress response, and causes of stress in EMS. Describe the defense mechanisms and management techniques commonly used to deal with stress, and describe the stages of the grieving process and the unique challenges for paramedics in dealing with themselves, adults, children, and other special populations related to their understanding of death and dying. This presentation was prepared by Waukesha County Technical College in Pewaukee, Wisconsin, and is distributed with an Attribution Non-Commercial Share-alike 4.0 International Creative Commons license. Copyright 2018 Waukesha County Technical College. For information on WCTC's numerous fire and EMS educational offerings, please visit us online at wctc.edu.